Welcome, Jane.
Thank you, Joan. It's good to be here.
It's so good to see you. I know we were planning, pre-COVID to be at the New York Self-Insured Conference.
Yes.
And this year it was in Saratoga, which I was
I
looking.
know. I was too. Yes.
But welcome. This is VISTV. We rolled this out about 2 months ago. It's a new platform that Viscardi is using to put a different outlook on communication in our industry, the insurance industry. So whether it's claims management or our medical management, we felt there was a need for better communication, a different way of bringing topics publicly, a different way of bringing leaders together to talk about and have conversations about things that are important in our industry. So that is why we're doing it. I welcome you for those watching. This is Jane Healy, Senior Director, DC Regional Claims from Marriott International. You also sit on the board of managers for the New York Self-Insured Association. So a busy person, for sure. So my hope is to bring leaders together to talk about leadership, inspiring leaders that can talk about how you motivate your team. I know how I motivate my team, also how we communicate. And I think COVID-19 has brought a change to how this is all done. Look at us both, we're remotely working. I know myself, I manage a team in-house, yet we were quick to transition to remote. How did it work for you? And talk to me a little bit about your leadership during this time.
Well, just as you said, everything happened very quickly. And we had some that worked remotely, but not the entire staff. And it was just 1 or 2 days a week. And we were just starting to move into having the associates having that flexibility. We had it probably for maybe 6 months beforehand. And then boom, everyone got the laptop and learned to work remotely. And there was a lot of uncertainty going on at the same time. So it really involved a lot of just being transparent and acknowledging that this is a challenge. We had my department has 2 separate teams. One is the casualty claims, and then the other is a short-term disability team, and they had not worked remotely at all, or paperless, I should say. So they really had to jump into being remote and learning to work without paper and learning to document everything in the file itself rather than handwritten notes. And I just was so proud of them and so impressed that they got the job done. They acclimated quickly. As a leader, it's been, you have to be, you want to be visible to them, and it's so much easier when you're there with them. As you know, walking around the office, you get a better feel. You check on the energy level or just what you can observe, and you have to make that effort. I mean, there are people that I would just have my morning chats with as I arrived and then was walking to the kitchen to, I just had my routine, and I don't have that anymore, and you have to make that effort to. I mean, we have the Teams page, and I'm sure many companies do. We're just some kind of board where people can communicate. We post things, little memes or GIFs or just sayings and things to chatter that way. So it's adapting to making that so that you get engagement, but you're keeping visible too. And
right.
When we have weekly meetings, I want cameras on just so that.
You're a person after my own heart, and the changes in direction and the positivity. And I found with a lot of my team, as a team, you see them differently physically. When I moved them remotely, all of them, I had to really concern myself individually with the members, because some people are not comfortable working remotely. Some people need other people to inspire them.
Yes.
Yeah,
They're
so
just
as a leader.
You do, and even just the learnings that you get from listening to other people, in the claims arena, how they handle different phone calls or challenges, to be able to learn from a conversation, both ways, not only to learn from someone, but also to coach as needed, to say, hey, I heard that, it sounded like
Oh,
you were frustrated. Yeah, what I found works for me. Or,
exactly.
oh, I've had that happen and here's how I
Exactly.
handled it. It just, uh, you lose
That's
that.
very true. In our business of medical management,
Mhm.
and it's primarily in the workers' comp sector, we deal with a plethora of stakeholders, but primarily it's the claimant. It's the one who requires the care, needs the assistance by a nurse. The nurse then has assistance by an admin to make sure that treatment is expedited, care is compassionate, and you're spot on in saying that without being a leader that can be there to hear that dialogue, it's oftentimes hard to see how that assessment went. How is that relationship going? So we do a lot of research into how do the claim adjusters feel about it? How are they doing? How is the employer doing? We take the entire group and from an inside out approach, look at how the claim is being handled and then determine what is necessary. So I find the other thing I wanted to talk to you about is technology. I find that having the technology now, such as this, a virtual
Yes.
remote
Yes.
call can help for sure. We also proprietary database that allows us to share information. So as a leader, I can track how people are doing and kind of grade on scale how care is being given. But how do you do that? You have a large team. You also have multiple jurisdictions, I
Yes.
understand.
Yes, we do. Maryland, DC, Virginia, West Virginia, New Jersey, New York, DC,
That's
Delaware. So
substantial.
yes, we
Especially
do.
during COVID, they all have different phases of rolling out.
Yes. Yes.
How are you looking at that currently in this environment? Does technology help you in any way? Does any
Well, it
particular
helps us
skill?
because we're able to keep up with all the different developments with the courts, how the jurisdictions as to how they're handling it. And a lot of it comes from our different defense counsel too. Not only do we research it, but we get updates from defense counsel on what's going on. One thing that has changed is that we've seen that there's been telemedicine, more
Yes.
telemedicine appointments that we
Yes.
didn't have before, which I think has been a big help
I
for many
agree.
of the associates.
I think that will stay, and I've seen a tremendous increase in the telemedicine visits, which is good. Clients are
Yeah,
still a little hesitant about going to a physical office and being with other.
exactly. Yes,
Yeah,
understandable.
yeah. I know myself.
Sure.
I haven't seen a dentist.
I know. Yeah.
I was due to have a cap the week that we shut down. I actually thought, oh, that's fine. I didn't want to do that anyway.
I think there'll be a lot of things on hold that have absolutely.
Have you
Absolutely.
seen a change in your team, in your team's approach, in their outlook on the future and work? How does your team approach you now in this remote environment?
It's something that we try to keep in our weekly team meetings just to address it, and it's me reaching out. We have the whole spectrum. There are those who are as happy as they can be, and
Mhm.
it could stay this way for the rest of their career, and they would be happy. I'm saying rest of their career, but they're very content. This works fine. They don't miss the
Yes,
long
yes.
commute. They've gotten an
Oh,
hour
yeah.
back or 2 hours from the hour each way commute, and others who really miss being around the people, and
Yeah.
they're struggling with it. And we don't
You know, I
have,
think I
you
think
know,
to I
go
think
ahead.
to inspire as a leader, you have to be inspired yourself. I found you very inspiring to me. You know, um, I have a women-owned business, and it is in many ways I've been mentored by men and women alike. But it was that relationship that was why I wanted to bring you to VISTV, because I thought we had very kindred spirits in how we inspire people compassionately work with people. And I think that's necessary now. We have weekly meetings as well. And we actually do desk meetings. We actually try to
Oh,
get
how
people to
wonderful.
move.
Yes,
And
that's good.
we have some mindfulness at the end of every meeting, whether
That's
people want,
good.
not just
Mhm.
a moment where we're mindful of the environment and the surroundings. But I think
Yeah.
the pandemic, on top of the political, social, civil rights situation that we're in, has led to complications in keeping spirit and morale up.
Yes.
And we know, as I do, the more we can motivate, the better the outcome.
Yeah. I think it's something you just have to put more, I don't want to say more energy because you care about them. The Marriott culture is people first. That's a core value, but so I'm fortunate to have to work for a company that has that in the focus, but that's the reality anyway. It's our relationships is how, and I think if anything, I would want them to know that I do care for them, and I think that they do. And that's where the team meetings are good, but the individual calls, especially knowing what's going on with different people who, the one who might have the young children at home and
Yes,
trying to deal with that, and just empathy. One, just the upheaval and the uncertainty and the
definitely,
scariness
definitely.
that this is uncharted for all of this.
Yeah, yeah.
But
It's
this,
funny you mentioned paper writing. I was trained as an intensive care nurse many ions ago, and everything was documented. It was legal. It was the legal document. You had to document everything, things that you were going to do for the patient, that you planned to do, that you did. And we went to paperless probably about 5 years ago. For the nurses, it was the hardest thing. It was the hardest thing to for that I still handle cases. I try to handle complicated cases and just to keep my hands on, whether it's a new client, a new employer. And I found I was still writing. I still needed to write it.
yeah,
Now
well,
I think with remote, everything will be shared electronically.
yes. Oh, I find that when you say it to write, I mean, the times that I have to write, my handwriting has gotten so illegible because I'm used to typing everything. It's a good exercise, but half the time when they look at it, they're like, "What is this? I can't
It
read it."
really is. It really, really is. It really is.
Yeah.
Is there anything you want to talk about? Anything that you'd like to add on the industry side, on
Uh,
leadership, technology, anything you want to talk about in particular?
I think it just will be interesting to see where we go with this.
Mhm.
I think that's what I wonder how, and as leaders, you're so used to looking at goals and identifying where you're going, and the goals are, we just don't know. All we can do is hone our processes now, and it's kind of an inner core, our strengths, and identify those, and the buzzwords now are agile and flexible, and see where they go. But there
Yeah,
is just a lot of upheaval, a lot of finger
exactly.
pointing and anxiety, and my hope is just that we will take the good from all this and move
And
forward
learn
from
from it.
it.
Yeah,
Yes.
yeah, learn from it.
To um, and I, I see that even just in some of the conversations that you have, even calling the injured workers, or even just defense counsel, or even adversary counsel, or any kind of, it's hope you're well. How is your family? I'd like to think that there's a concern that maybe there wasn't before.
Yeah,
That
I
maybe
agree with that.
recognizing that, okay, it just kind of helps you hone in and identify where your priorities are and who you
Right.
are. And
One, I think identify with others. I think a large reason protests came out at this time versus, I lived through the 1960s civil
yeah,
rights
I
movement.
did too.
I think a lot has come out of it course, we are all in this together, like you said. I speak to many claimants on the phone who end it with "be safe" and
Yeah.
"be well," and
Yes,
I think
yes.
that
Isn't that
that
nice?
is it's so nice. Where
Yes,
concern is twofold now. It's directional. We
I
all
agree.
seem to be
Yeah,
caring more for each other.
I
I,
think so.
I hope that continues.
I do too. I do
Yeah,
too.
I hope that continues.
Yeah.
Well, it's been a pleasure.
Thank you. Thank you. You as well, Joan. You
I'm
as
so
well.
glad to see you. So glad to
Yeah.
see you. I'm glad your
Thank you.
family as well and you're
Yes.
healthy.
You as well.
Be well,
You
be
as well.
safe. If you ever
Yes.
want to chat about anything outside of the industry,
Okay, I will.
I wish we lived close by for coffee.
I know. We'll get some coffee one of these days. We will.
We will.
Okay.
You,
All right,
you take
Joan.
care,
Thank you.
Jane.
You
Bye
too.
bye.
Take care. Bye.